Okay, so ladies and gentlemen, you are welcome. So in this video, we are going to look at the basic concept of epidemiology. So what is epidemiology? Epidemiology is the study of how diseases affect the health and illness of populations. So when we are talking about epidemiology, it's one of the branches of medicine that is associated with the study of how a particular disease affects the health and the illness of a particular population. So therefore, in epidemiology, we are dealing with the effects of how a disease affects the health and the illness of the population. And very importantly, epidemiology, it focuses on understanding the distribution and determinant of health-related state or event. So in epidemiology, it is associated with distribution. Like, for example, if you have a particular disease in Nigeria, so based on epidemiological studies, is that disease also in Ghana? Is it also in Japan? Is it also distributed across African countries? If it distributed across the African countries, what is the variation? What are the incidence rates? What are the incidence rates? What are the prevalence of the disease? So epidemiology, it is also associated with the pattern of the disease and also the determinant, the factors or the causes of a particular disease. So epidemiology, it is associated with first, the causes of the disease, the factors that are associated with the disease, and also the distribution as well as the pattern of the disease. So that is why whenever we are doing epidemiological studies, it is associated with the prevalence, the incidence, the causes, the distribution, and the pattern of the disease, and also how that disease affect a particular population. That is epidemiology. So in epidemiology or epidemiologists, when we say epidemiologists, it means that are those scientists that study epidemiology. And these epidemiologists usually they use statistics and research methods to identify risk factors for disease and targets for preventive health care. So that is why in epidemiology, it is very, very important, ladies and gentlemen, to have a good knowledge of statistics as well as a research methodology. So epidemiology, it's linked with statistic and research methodology because it is the statistical and the research methods that we apply in order to identify the risk factors of the disease as well as the target for preventive health care. So that is epidemiology. So it's linked with the diseases, the effect of the disease in a particular population, the distribution of the disease, as well as the factors that are associated with causing that particular disease. So there are some key concepts and key terms that we need to know in epidemiological studies, and the concept of incidence and prevalence are fundamental to understanding disease frequency. So what is incidence? Incidence, it refers to the number of new cases of a disease in a specific population over a certain period. So you see, the incidence it is talking about to calculate the number of new cases of a disease in a specific population over a certain period of time. While in the case of prevalence, as we can see, it indicates the total number of cases of both new and existing within a population at a given time. So you can see clearly here, ladies and gentlemen, you shouldn't forget about this term. In the case of incidence, it is associated with the number of cases of a disease or the number of new cases of a disease in a specific time frame. So the new cases. But in the case of prevalence, it means the number of existing cases of disease at a specific time. So that is what we need to understand. So the new cases, let's assume now we are talking about, let's say, coronavirus. So the coronavirus, if we are talking about the incidence, it means to calculate the number of new cases of the disease. But for the prevalence, is to calculate the number of existing cases of the disease at a specific time. So that is the incidence. So for the incidence, you are calculating the number of new cases, while for the prevalence, you are calculating the number of the existing cases. And in the case of numerator, usually the incidence, it means that the population are at risk. Also, in the case of prevalence, it indicates that the population are at risk. And uses, it expresses the risk of becoming ill, because anytime we calculate the new cases, that is the incidence, it is telling you that the probability of you come up with the disease. So it expresses the risk of becoming ill. And then for the case of incidence, it estimates the probability of the population being ill at a period of time being studied. So this is the most important thing that you need to calculate. And then for the prevalence, if you want to calculate prevalence, it's equal to incidence times duration, and that is how to calculate in prevalence. Although there are so many cases that you can use to calculate prevalence, but the most important thing, in the case of incidence, you are calculating the number of new cases, while in the prevalence, you are calculating the number of the existing cases of the disease at specific time. So what are the importance of epidemiology? Importance of epidemiology, it plays a crucial role in guiding public health policy and practice, and also provide evidence for the development of health programs and intervention aimed at disease prevention. By understanding disease patterns, epidemiologists can respond effectively to health crises and improve population health outcomes. So that is why in epidemiology, it is very important to determine the patterns of the disease. Is it increasing? Is the disease increasing or decreasing? So from there, you will know whether the intervention is having effects on reducing the prevalent cases or the incidence of disease in the population. So these are some of the importance of epidemiological studies. So ladies and gentlemen, in this course, epidemiology, it's associated with the study of diseases, the prevalence of the disease, the determinant of the disease, the distribution of the disease, as well as the pattern of the disease. So ladies and gentlemen, please follow us in this of my YouTube channel, subscribe for more video. Thank you very much and see you next.